From a public health perspective, preterm birth is just an enormous problem. 75% of infant mortality is due to preterm. The financial cost is in the billions. Even when the prognosis is good, the babies oftentimes end up staying in the hospital even just a few days longer, and that has enormous implications. And the personal cost of developmental delays and problems. Understanding the underlying biological basis of preterm birth and trying to prevent it would save an enormous amount of resources, human, financial, everything across the board. The major focus of my research has been on health disparities and different presentations and risk of disease in different populations. And about 15 years ago, somebody approached me and said, we're interested in studying this problem. And to be honest, I didn't know that much about it. The disparity between African American and European Americans was compelling to me, because these underlying differences are obviously very complex in terms of their causation. When you start looking at disease presentation, disease risk, the difference between populations, given my background, I asked the question, why do we have one population where 20% of the people are presenting with the disease and another where it's under 10%? What are the underlying causes of such an uneven distribution of disease? The March for Dimes has been instrumental in developing the kinds of collaborations that are necessary to solving the preterm birth problem. These transdisciplinary centers and the March of Dimes support for them is going to move things forward in a way that normal research doesn't go. And I think that's really the key. I'm not going to solve the problem by myself. Someone who does, nutritional epidemiology isn't going to solve it by themselves. But if we all get together and sit at the table, figuratively of course, or sometimes in reality, then we can do it much better, more efficiently, and for less cost. And I think that these transdisciplinary centers and the March of Dimes taking the initiative to developing these has really changed the playing field for the field.